Hello, good evening, and welcome to all of you for the ninth episode of Inside Out. Tonight, my guest is someone who's just 34 years of age, but if you consider what he's achieved in this life of his so far, it's phenomenal. He's at an age where generally people are looking as to where to go in life, where to head, but he's already made rapid strides. He is a qualified doctor and currently is the collector of Tirpur, and he's been involved in the management of tackling this pandemic that has been a big problem all over the world. It's my pleasure to present to you Dr. Vijay Karthikeyan. Welcome and good evening, sir.
Hello, sir. Good evening. Very nice talking to you as well, and happy to be on the show Inside Out, and happy to talk to you.
Apart from your qualification as a doctor and, of course, as an IAS officer, you're also a good cartoonist, I heard.
Yes, sir. I do a bit of cartooning here and there, and whatever Tamil books that I have written, incidentally, my first book was for Vigadan Publishers, and if you see, they have this cartoon thing as a part of their own publications. So when I started writing my book for them, naturally I thought I should put in some cartoons also, and thankfully it came out well. And subsequently, with other Tamil books, I started experimenting and exploring that, and drawing more cartoons in my books.
Okay, first of all, congratulations to you and all of you in the Tamil Nadu state government for doing a tremendous job during what has
Thank
been
you.
a very tough time in all respects. I'll talk to you first as a doctor. Let's get your views as a doctor. People have been quite scared of COVID. In the first place, do they need to be scared of this?
They should be cautious of COVID. They should definitely be wary of it, and they should know the facts, right? But I don't see a reason for people to panic and be extremely, like you say, scared. And uh, people should be more cautious. People should be more vigilant. But at the same time, they should take it in their stride and move forward, taking the adequate precautions and following the guidelines set forth by the government and various health agencies. Is what I feel.
According, according to the press reports, obviously, you can't believe everything that appears in the press these days. There's also been a societal issue in that infected people have been ostracized in some places. Have you come across that?
Thankfully, unfortunately, none in Tirupur district so far. But then, yeah, that is an important issue to be addressed, like you said, sir, because we have seen in the past also other how other epidemics were seen, and that sort of an outlook created a lot of social issues as well. But I think it's a very sensitive issue, and we need more care towards that aspect, and which is why we have put in a lot of volunteering agencies to again monitor this particular aspect, and also bring in that take into consideration the mental aspect also, not just to the affected people but across, send the message across to the entire community to again take it into their fold and move forward as a group.
You said people have to be cautious. Now, there is a school of thought that is being repeatedly saying that 70 to 80% of people who get infected will survive this infection. What is the reality?
Yeah, that is actually true. From the what the numbers actually say are also very similar. It is not that everybody who's getting the disease are going to the terminal stage and get into an unfortunate circumstance. Numbers show that worldwide also, countrywide also, again, very few require hospitalization, and among those, very few require intensive care, and among those, very few again require ventilator, and among those, very few may meet an unfortunate end. That is why I think the government also has classified the categorization of the places where they get admit also. There are three tiers currently called the COVID care centers, and then the health centers, and then the final the hospital that they go, the tertiary care hospitals that they're taken into. So accordingly, people are categorized also, and home care and home isolation are also becoming a part of the process.
Now, one positive factor has been the increase in the number of recoveries in Tamil Nadu. That should come as a big relief to all of you.
Yeah, definitely, sir. That also has been a very positive factor, and like we just discussed, that again corroborates the same fact that not everybody infected will go on to the terminal stage. Various people, again, depends on a lot of other factors, including the healthcare, early detection of the disease, comorbid factors, and the other immunity levels, and so on. So luckily, I think we are progressing well also, and thanks to the efforts of everybody, the government, the voluntary agencies, the again people, and we are on track, and we should be able to get there sooner than later.
Uh, this has been one pandemic which has left the entire experts in medicine, science, and epidemiology completely stumped, isn't it? Because there's
True,
been a lot of learning on a day-to-day basis.
true. Yeah, like you just mentioned, I myself, I currently hold this latest edition of community medicine book with me. I do read up, brush up, keep myself updated as to what's happening, because it's very difficult. The pattern, the strain, they say, keeps varying. We don't know the exact virulence. So the lot of again learning to do, and a lot of catching up to do, not just us, across the globe. Again, whatever strain that is used for the PCR tests, again the kind of strain that matches with our country, again the natural strain vis-a-vis European strain or a Chinese strain. So we don't know that, and again the sensitivity, specificity of the results also depend on all that. And not just that, the transmission rate as well, the doubling rate, a lot of things. Again, we are all learning, and we are all again on the job as to improve things on again real time basis. So that's the challenge. It's not that we have a set of protocols to be followed like we do in case of a dengue outbreak now, or any other, say, cholera or something else. It is again doing it and learning it, and again implementing it on a real time basis. That's a huge challenge, and we are all up for it.
We'll continue this fantastic information that Mr. Vijay Karthikeyan is providing. And for those watching on the YouTube, kindly subscribe to the channel and also allow your notifications. Doctor, just coming back to Tirupur now, and the surrounds had a lot of cases early on. What steps were taken to flatten the curve?
Hmm. Tirupur, when we look per se, again, the general things that we are again supposed to do, the guidelines. Firstly, again, the proper perimeter control of the district. People entering in, the travelers coming in, again, verify them, screen them properly, and then make them a part of the testing protocol, and then the containment subsequently. So that is the most crucial part, I feel. The containment, the effective, more effective the containment is, again, the lesser spread disease into the community. So again, all our containment zones are, again, people visiting from Chennai on inspections have remarked they're almost fortresses. So to that extent, we have put in multiple degrees of containment activities in place, be it the police personnel, be it the revenue department personnel. We've also put in volunteers for each house who are in quarantine, again to take care of them, like we had discussed earlier also, again to keep them mentally happy. We have a team to call them and talk to these people in quarantine, to inquire about their well-being, and then arrange their essential supplies if they are closed for containment, and their supplies and everything have to be taken care of and all that. And apart from that, in Tirupur, a couple of other initiatives that we've taken that I would like to mention here. We have again kept a special watch on the super spreaders, the potential super spreaders we have identified, like people in the market, the newspaper vendor, and the grocery shop person, and all that. And we have a team going around and again screening them systematically and bringing them a part of the fold, so that these super spreaders are kept on watch, and they are not allowed to transmit the disease in a large scale. So that is one thing that we have tried in Tirupur, and it has come out well. Secondly, this we have done another interesting thing. The paracetamol sale across the district, we have again through our official machinery, we have enumerated, and we have checked across to see that, say a taluk wise, say a block wise, how much of sale of this tablet has been. So that indirectly indicates, it's a proxy indicator for fever in the area, outbreak of a fever in the area. So we get the cases, we go conduct fever camps, detect them, test them, take them to the hospital. But then we may miss out on certain cases. But these things also can be tracked, and we can get a rough idea if there is a fever burden in particular area. So that sort of a mapping we could do by tracking the paracetamol sales. And I was going through the results. I was happy to see that compared to April, May, and there's a slight dip towards June and so on. So that indirectly means that there is no spike in a fever cluster in particular zone or a particular block. These are all indirect indicators. I mean, there are a lot of direct things that we do, like conducting fever camps, taking the PCR samples, etc. But then these things help out with us. This sort of data will help us again to manage better, and again go to those places and concentrate on those places better. Like I said, these containment areas, we also mapped houses belonging to such and such areas. Wherever the houses are more, the containment areas, there we do more disinfection, and also the e-passes that we get. For example, somebody comes from Chennai, so a lot of people may come. Again, through e-pass, we track to which area they are going. So beforehand, we again put our people there for disinfection and other activities also. So these things help us. Being a step ahead, it helps us to again calculate and focus our energy and attention and personnel on things that we need more.
Talking of testing, how amenable were people to subject to testing because of the fear factor?
Fear factor definitely was there, sir, like you had just mentioned. But then the more and more people come forward and tested, and it happens, and then slowly sets in and sinks in. And initially, the international travelers were tested, and then the interstate travelers, and so on. And then the frontline workers' attention started to. I myself tested myself, or other officials, the members of the press were tested, volunteers were tested, and then people again were sensitized enough, and now it has become a routine that we also have a walk-in kiosk and a mobile testing facility, so that we could go to their places, and wherever we do the fever camps, we could do the sample taking also. So those things again go, rather than walking into a hospital, psychologically people may feel more convenient to again give it in a van that comes to their neighborhood. So those things we had considered, and we have tried out.
As a doctor, you must be phenomenally proud of the job done by the doctors, the nurses, and all of them in the hospitals. And as an administrator, the others who've been the frontline warriors, so-called frontline warriors, as they've been termed rather, you must be phenomenally proud on both counts, because it takes selfless work from all these people day in and day out, and that too being aware of the fact that they might get infected as well.
Yeah, definitely. Extremely proud of that. And I don't know how to thank them. I've told them in multiple meetings, and every time I meet them, it's our duty to again motivate them and keep them going. We don't know still as to how long it will go on, how long they will have to keep going on with the kind of intensity they have been working all these months. So it is extremely difficult, and putting them again, they also have houses to go back to. The same thing that I am told at my house when I leave the place. They also have families again to go back to, and they are again, they need to focus on the job as well, and a lot of uncertainties and a lot of pressure as well. Again, a lot of numbers to again look into, and this again protocol keeps changing, and we have to do a lot of dynamic things. So that adaptation is also very crucial, and I'm really thankful to each and every one of them for having stepping up into this situation and taking it forward. I really wish this whole thing is again comes to a very good. I think the whole thing settles down, and they all can get back to their normal life as quickly as possible.
To me, all of those frontline warriors across the country have been precious gems of the country, very honestly. Now,
True.
we are talking about testing. Now, another thing that we need to sort of know as lay persons is that there's been a lot of discussions, there's been a sort of varied schools of thought on the testing method. Why was
Hmm.
there a little bit of confusion some time ago?
Again, initially we again are doing PCR testing, polymerase chain reaction, RT-PCR testing. So that is a confirmatory test that we do. Again, the throat or nasopharyngeal samples are taken and tested. So thing is, we have a focused testing protocol. That is, we have certain list of people to again go into focused form of testing to detect the index case. That is international travelers, interstate travelers, hotspot travelers, and then again, if there is an index case, their primary contacts, secondary contacts, the immediate family members and neighbors in the entire street, in fact, their samples will be taken. And then all the ANC cases, the pregnant women, and ILI and SARA cases, the influenza-like illnesses that we find, and the fever cases that come to the OPD, all those cases we are supposed to take samples. So this is roughly the protocol that we have to follow to take the tests and to go forward. Again, say a district like Tirupur, for example, 3 million plus currently. Again, we have the resources, government has resources. They are again continuously, the supply chain is happening. But then instead of haphazardly going ahead and testing people randomly, this sort of a focused approach gives us again the headway into detecting the cases quickly as to testing the people who are more likely to get the disease and then going from there, taking it from there is easier than randomly going ahead and picking people. So that is the approach we have taken. It is a very clear approach, and we have again got the results that we have decided so far, and we hope to keep working towards that.
You experimented with sanitization booths in the market areas. It was stopped. Why
Yeah.
was it stopped?
I don't know, frankly. It was a decision taken at the policy level. It was an experiment, like you had mentioned. A couple of youngsters had again worked out this and had approached me. So I've always been open to new ideas. So we thought we'll do this. Why not? And we tried it, and about more than lakh people passed through that sanitation tunnels, and it was again as far as public were concerned, we didn't see any adverse effects, or it was taken well. But then it was again in a quick span. It was replicated at a lot of other places, but suddenly there was some communication to not go ahead with that anymore, and that's the last thing I heard about that.
Am I right in saying that you started stacking the vending machines, the sachets of sanitizers after the booths were taken off?
We have done that also, sir. We have done automated vending machines of the vending of sanitizers, and we also done this automated thermal scanners where walk-in people will again automatically be scanned for their temperature instead of putting a machine on them. Whatever they walk through itself, the temperature would again be detected. A lot of other things we have tried in Tirupur.
Now I'll talk to you as an administrator now. The biggest challenge across the country for all the states was that they had to send the guest workers, which you gracefully coined, that term you coined it, was to send them back to their respective places. That must have been a big challenge, isn't it?
Yes, sir, definitely. It was a big challenge. And Tirupur, it is again an industrial city. And when I joined, I had a look at this, and I was surprised. Again, I knew that there were a lot of workers, but then there were workers from each and every state of India, the guest workers. And at a crisis scenario as this, and again, we had to enumerate all of them. We had to see, get a portal for them to fill in and given their details, because we cannot take them to a single place and make them fill it. Again, the distancing guidelines are all there. So again, we had to call them up, and we had to give them an online link to fill in. People who could not fill and all that, we had to call and take down over phone and get the data, everything. And fortunately, this exercise also helped us in getting a database of all the workers with their Aadhaar numbers, etc. And after that, we again had to get in touch with their respective governments, and then we had to get their concurrence, and then we had to get in touch with the railways and get the trains ready for the next days and subsequent days. And then we had to prepare the charts, because these are all again the Shramik trains are all exclusively for this. So we had to again put them in every coach wise. We had to allot them, and then give them food, water, etc. A 2-day journey, 3-day journey, everything had to be arranged. It was a very tough job. Again, if the train had to leave at say 10 o'clock in the morning, we had to again bring them to the venue at 6 a.m. To the railway station. Again, distancing, the screening, medical screening, everything had to be done. 4 hours was required. So to bring them at 6 o'clock, people had to wake up at somewhere like 2:30, 3 a.m. in the morning. So it was difficult for all of us. By then, this schedule will be over for this day. Next day schedule will start. So every day, 2 trains, 3 trains like that. And say we had sent close to 60, 70,000 people like that. Say 1,600 per train. We had sent around 70,000 people back. And most of them, again, I mean, all of them were very comfortable and happy going home. End of it, most of them, what they told me was, it was not that they did not like the place and they are going. It was not that they had any problems here, because prior to their going home, we took care of their ration and other day-to-day needs also. Industries also took good care of them. But then again, their emotional quotient was always that also played a big role, and they wanted to go home. Their heart was again with their families. A lot of them, they wanted to again go home and then maybe come back at a later time. That's what they told me. We have all the facilities here. We are very happy here, but then our families are there. We miss them. We need to get back home. That was the thought, and that was the mood among them. So again, we had to do the entire process. Like you said, it was a very tough and Herculean process, but I'm glad that we could do it the way that we did it. So it's a very again fulfilling exercise that we could do.
Now, Tirupur, how has it been hit with the return of these people back to their respective places on an economic scale? How badly have they been affected? The manufacturing
Uh,
units in Tirupur.
yeah. Firstly, sir, this until this June to September is supposedly their lean period. They say generally these workers commute during this period, so that is one thing which works in favor. Secondly, since the global market is down, now they are currently doing what is called the sampling process. They have started taking orders from European market and the other major markets, but then currently they're what they do is initially they do the samples, send it across to Europe, and then their orders are finalized, and then they start doing it in the large scale. So the sampling and order finalization process is happening now after the industries have opened, and for that they need say 25-30% of their original strength is enough to do that. With that they are managing now, and also other district people and a lot of employment for the Tamilian workforce within the state. So we are again making use of them into this, and Tirupur has emerged as a PPE mask making hub during this COVID crisis. So the PPE kits and the masks for the entire state goes from Tirupur to the government machinery, not just to Tamil Nadu, to Kerala, to Telangana, to other states as well, and even certain government of India organizations place their orders at Tirupur. So that ways the industry has been able to match up and compensate towards the other economic losses that they could otherwise faced because of this.
Yeah, they've just found some other avenue to stay afloat.
True.
But how are you planning to help the businesses revive in the near future?
Again, in MSME sector, it's a lot of credit lines have been opened up now, and a lot of schemes have been formulated. We also had a lot of stakeholder meetings with the industries, and they are more or less happy with whatever schemes that have come through their credit lines. They also put forth certain suggestions, like again working capital margins to fix up, and again the rates and so on. So we are again internally discussing all those things, and I'm sure those things would be of help. And even at lower level, say a village level, a self-help group level, a lot of special loans called the COVID loans are again being sanctioned. These are all very interest friendly and long-term repayment loans. Say a 5,000 rupee, a rough 5,000 rupee can be repaid in say what 36 months and so on. So that again would I'm sure would again help in bringing in that sort of a fluidity at the grassroots level, the village level. So I think that sort of steps are being taken, and I'm sure that will be of help to a lot of people.
The exceptional thing that you've been doing is been encouraging home quarantine for the infected patients. Now, how well have the people cooperated with regard to your guidelines and directives?
Yeah, well, one small clarification here. That is, yeah, home isolation we haven't started yet. The caseload hasn't gone to that extent that positive patients we are keeping at home and treating. So the infected people we have not kept in home quarantine yet, sir. But then people who could or who could not, that sort of category people who are again mostly travelers we are putting in home quarantine. And one more thing is, in our experience, we have seen that people who tested negative, say between day 5 and day 4 of the infection, few of them have turned positive by the time they got again after some time. So it's always good to take second sample. And so the keeping that in mind and keeping again the travel history in mind, we're putting all the travelers in home quarantine, so that we don't give that chance also to again to the spread of disease. And like you said, it is very important to monitor that, and we have put in volunteers for every house now, so that every house is taken care of and monitored personally.
Your decision making skills must have been tested to the limit in the last few months. How well do you think you fared? What rating would you give yourself on a scale of 1 to 10?
I will grade myself a very gracious 8. I'll be lenient to myself, but then it was difficult, sir, like you had mentioned. But I've learned a lot as well during the process, and so I'll give myself an 8.
No, I tell you personally, all the criticism that's come all over the place, that apart, I think this was a no-win situation for any decision maker, because whatever
True.
decision you take, it would be eventually proved wrong, because things were happening so fast and things were drastically changing. There were so many variables, so many things to cater to. It was not an easy situation to be in for
True.
any
I
decision
know.
maker.
True. I'll just come in and quote you again. This World Cup I was watching in Australia, the final India Australia Women's World Cup. Again, the team opened with a spinner when we bowled first. The again that was a big decision. End of it, I could see you tense in the dugout as well. All of us were expecting, and these are all the split second decisions that we take that come through, or they don't come through. Again, same thing can be said. So many examples from cricket itself. So again, I always feel that quick decision is always better than a late decision. So good or bad, a quick decision we can again justify it, and again at least correct it if it is grossly wrong. So I have always had that in mind to take quick decisions in crisis situation, and fortunately it has worked for me.
Recently, there has been a little bit of a spike in numbers in a few districts, and Chennai has been having a little bit of a spike, but that's coming down now. But do these increase in numbers worry you?
Not much, sir, because this was all expected. Once the again the travel was opened, and then subsequently people started moving out of Chennai. Again, it was expected, and when we look at it again to the other states, and also look at the global pattern, also this has been again the case, and all countries have faced it, and I think we also should face this and go through the pattern of the disease itself. It will not be that we will not get any case, and the disease will be wiped out entirely from the community. So the options that we are looking at here is that a vaccine will come through, or the virus will lose its virulence, or strain may change and it will become very weak, or a herd immunity will develop to us. Say, so again, seeing looking at the pattern, it has to go through again to again whatever measures that we take, we can again slow the transmission, stop the transmission as much as possible. But then the natural cycle of the virus will definitely go through. But we need to again face it as much as possible in our own set of guidelines and overcome it.
Have there been times when you are frustrated in these last few months?
Yeah, definitely, I will be lying if I say if I were not. Almost every day, somehow I find myself again out of it, and thankfully I have a very supportive family as well, and I do some writing as well, so to take my mind off here and there. But I don't get the time. But then whatever 5-10 minutes also, I keep scribbling 4-5 lines, whatever comes to my mind, so that keeps me afloat.
Despite the tremendous amount of work put in, both in terms of quantity and quality, it's not over yet for you, is it? There's a lot more to be done.
Yeah, definitely not at all over yet. A lot of work has to be done now. Again, one theory is that the metros all spike up quickly, and then the disease come to the other tier cities, and so on. And we cannot be again. We have to be on our toes, and we have to be focused all the time. And we have to again go through the entire thing with the same intensity, and we have to again somehow keep ourselves motivated and the team around us motivated also, because we don't know yet as to how long it will go on, but definitely it will go on until any of the three things that we discussed happens. So until then, we'll have to keep fighting and keep fighting hard.
You've been hands-on in the last few months as an administrator, of course, but you also have the advantage of having the medical knowledge too. Now, how do you see things panning out in the remaining part of the year?
Remaining part of the year, again, as a doctor, whatever we have seen now, this pattern would again likely to go on, and one of these three things we are looking at: vaccine or virus losing the strain or the virulence, or third thing is herd immunity, and we will have to again focus on the treatment part. The front end is again detecting and testing. Back end is the treatment. So the kind of discharges, getting the discharges quickly, and most importantly, preventing deaths. That nothing beats that result. So getting that result as much as possible, I think we have done well, getting the deaths to nil, and focusing on the treatment quickly, and the discharges quickly. I think until one of these three things happen, I think we should be able to do good. And also again keep again balancing it with the economic, because the unlock processes have also started. So again we should again balance it. For me as an administrator, it's very important to look at that aspect as well. For especially as a district like Tirupur, so much is dependent on the economic activity, not just for the district but for the entire state, and in fact entire country as well. So again we need to keep that as well going, and lot of human resource development as well. See, we again have to keep the education system going as well. We have to keep the social sector working. So a lot of things to focus on, and we cannot lose out on any of them, but for this. So I think it's very important to focus on all these things and take things forward.
Uh, the TN government has done a fabulous job, and let's assume that there's no vaccine that's developed in the next 6 months. Let's say the virulence doesn't subside. Are we geared to handle that kind of a situation, let's say, for the next 6 months?
Yeah, we are definitely geared, sir. We have, like I said, we have three tiered systems now. The first thing is the COVID care centers, where the asymptomatic or mildly symptomatic people, say roughly 85% of the people fall into that. Even if we are tested positive, 85% of the people are asymptomatic or very mildly symptomatic. So they can be taken care of at the COVID care centers that we have. For example, we have identified such marriage halls, convention centers, and we have put our facilities in Tirupur. In case there is a huge spike and a very emergent situation, we could again these beds and everything are in place even now. So even now if there is some inflow of huge number of cases, we will be able to manage putting them in those care centers. So secondly, the next set of people, the next 10% of the people who will have symptoms like fever, cough, breathlessness, etc., they will be again put into the hospital setup that we have. And again, the last 5% or the 3% again who would require intensive care and oxygen supply, ventilators, and so on will need that sort of a intensive care setup. So again, we have geared up. Every district in the state has geared up towards that. In case situation goes out of hand, also we should be prepared. And I think we are all ready, even if that is the case.
Now, whatever work that the governments do, the various district collectorates do, it has to be complemented by cooperation from the public. Now, what would you expect the public to do from their side to make this a more manageable situation?
Yeah, they have to do again simple things like wearing a mask when they wherever they go out, physical distancing at every place, go be it a shop or be it again a restaurant or workplace, whichever place they are moving in. That physical distancing is more important, and wearing a mask, and then hand wash is very important as well. And then protecting the vulnerable groups in their families, the elderly, especially those with comorbidities, and also the children. That is very important. And then curbing information. Again, information is available in plenty today, but then spread of again news that people don't know for sure, or unverified things, or rumors to just make things sensational. I think people should avoid that. That tendency, I don't think is correct. That I think people should keep a watch on that. So these are the five things that I would like to say. Wear a mask all the time. Physical distancing has to be done. Hand washing is important. Take care of the vulnerable groups in your family and neighborhood. And information, please be careful and share only the authentic information and do not spread rumors. These are the 5 things I think people should have it in their mind.
Thank you very much, sir, for sparing your time in these busy times for you. It's been hectic, not only for a few weeks, but it's been for a few months. But despite that, you readily agreed to spare your time and share your thoughts. Thanks a lot. Carry on your fantastic work, and your work is much appreciated by everybody. Hopefully, you will get time sooner rather than later to go back to your sketching cartoons and writing a few more books. I wish you all the very best in the future.
Thank you, sir. Pleasure talking to you. Thank you. Okay.
And for the viewers now, I hope you enjoyed the chat. I will catch you soon on my next episode of Inside Out. Until then, stay safe and keep well. Good night.